Hi, my name is Laura Antonucci and I'm a staff researcher associate at UC San Diego. As for many of us, cancer hit my family, and this gave me a strong commitment to work in research with the focus of making a difference in how we treat cancer. As a passionate researcher, wife, and caregiver of cancer patients, I want to sincerely thank the Belmont Foundation for what they do to support our patients, their family, and research, and for recognizing my work in pancreatic cancer with the Inspiration Award. It is an honor to be part of this community and help to advocate and outreach what we know about pancreatic cancer. I want to give you a brief background of who I am. I started working on molecular and cellular mechanisms involved in cancer onset and progression during my training as a master's degree student and afterward as a PhD student in Italy. In 2014, I moved to the States and I joined as a postdoctoral fellow Dr. Karen Group here at UC San Diego, where I focus my research work on pancreatic cancer and inflammatory signaling pathways involved in its development and progression. Pancreatic cancer is projected to become the second leading cause of cancer-related death by 2030. Treatment options for pancreatic cancer are few and have barely advanced in the past 30 years. It is essential, so, to identify new and more effective treatments for this deadly disease, putting effort into early interception and novel therapeutic strategies. Well-established risk factors such as tobacco exposure, alcohol abuse, chronic pancreatitis, sugar and fat-rich diet, diabetes, all of those substantially increase the likelihood of pancreatic cancer onset due to chronic tissue damage as well as oxidative stress, a process that is related to the imbalance between production of free radical and their elimination by our natural defenses. Although the majority of newly diagnosed pancreatic cancer have somatic mutation in an oncogene named KRAS, such mutations never develop into pancreatic cancer unless they experience chronic pancreatic oxidative stress and tissue damage. The question is how stress and tissue injury trigger the progression of benign lesion to full cancer. And to answer this question, we have developed a novel and unique experimental system in which oxidative stress converts premalignant lesion to pancreatic cancer progenitor under well-controlled in vitro conditions. Our innovative experimental system consists of mouse pancreatic cells that harbor an oncogenic KRAS mutation, which are abnormal but not tumorigenic yet. These cells are cultured under conditions that make them form a three-dimensional structure called organoid that resemble structures that are present in the pancreas. When subjected to oxidative stress, the organoids are large and they undergo a characteristic morphological transition and they become malignant, such that after transplantation into a pancreas of an healthy mouse, they give rise to cancer. Using this system, we identify two key proteins, whose increased expression and activity convert premalignant organoid to full-blown PDAC. Importantly, these two proteins collaborate to switch on expression of other proteins downstream that stimulate lipid synthesis and metabolism and generation of new mitochondria that are the cellular power station, stimulating energy production. This process results in rapid proliferation of pancreatic cancer progenitor and provide protection from currently used chemotherapies. My research work is focused to identify the critical metabolic regulators that support the energetic demand of established cancer cells and confer resistance to chemotherapy and immunotherapies. The major impact of this project would be the identification of novel drug target and new drug combination that not been previously considered for pancreatic cancer therapy. We propose that treatment that will cut off the energy supply line used by pancreatic cancer cell will offer more effective and less toxic therapeutic option. Our unique experimental system also allows the rapid in vitro testing and optimization of best inhibitor and drug combination before their more labor-intensive validation in animals, a critical step for clinical development. We are all together in the fight to move the balance needle towards a life without cancer.